from the good old ABC, we've got a tragic story, call it tragic. This really shows you how things are like, not only in Victoria but throughout Australia in regards to this deadly pandemic, coronavirus pandemic, causing anxiety, burnout in most of Australia's healthcare workers. Got to feel sorry for them, the frontline workers, even though the hospitals are empty. It's just too much for them. It's too much for them. We got here Associate Professor Natasha Smallwood from, guess who? The Royal Melbourne Hospital is leading the national survey. If you don't know about the Royal Melbourne Hospital, you will be gobsmacked if you realised how evil they are, the ones that run the Royal Melbourne Hospital. Would have to be the most evilly run hospital in the world. But anyway, it's another story. A survey of more than 10,000 Australian healthcare workers has found more than half of them are feeling burned out by the demands of the coronavirus pandemic, and some are so fed up they are planning to quit. 10,000 healthcare workers. Well, we know 680 have died in nursing homes out of 800. We have people dying from cancer, all other terrible things in hospitals, but they just can't handle this COVID, apparently, these 10,000 Australian healthcare workers. When they took on the job, they should have known it was going to be, times like this, it was going to be tough. So far, 61% of the respondents reported anxiety. Must be a tough job being a nurse. Must be a tough job just being a nurse and having patients lying in bed. Must be a tough job. 58% reported being burnt out. Burnt out. What, they're running around for 10 hours a day, running around from ward to ward? Wards that are empty. Must be hard. Maybe you want to get out and do some hard work, digging up roads or something. Burnt out in hospitals that are empty. Natasha Smallwood conducted the survey. It said many respondents added in the comment section that they were planning to leave the workforce due to concerns about their mental health. They just can't cope with this terrible pandemic where the only people that seem to be dying are in Victoria. So we'll just stick to Victoria. So you tell me how all the other states of Australia, because it says, Australian healthcare workers. You tell me how all these other states, these healthcare workers, are burnt out. We'll get to the graph in a minute. She said it was difficult to know whether authorities were listening to concerns about anxiety, depression and burnout among healthcare workers. I won't go any more on this article, but let's just show you something here. This is today, October 15. We've had supposedly 904 deaths in 8 months. Let's look at the current cases of ICU. 1. 0 in Victoria. 1 person in New South Wales. These healthcare workers must be flat out. 1 person in ICU. We've got 27 in hospitals. 27 in hospitals all over Australia, 21 Victoria. You might say 21 in Victoria. Well, there's not many hospitals. There's not many hospitals, so they're pretty busy with 27 people in COVID supposed care. 27, 21 in Victoria. It's a lot of people. I mean, the strain on these healthcare workers must be unbelievable. The 10,000 that were surveyed. 10,000 surveyed, and there's 27 in hospitals. How many hospitals are there in Victoria? Anyone got any idea? Victoria has over 300 hospitals and health services. 300 hospitals, and we have 27 throughout Australia, 21 in Victoria. So we've got 21 people spread among 300 hospitals. Really? I mean, come on. It's not even one per hospital. It's 1/15 of a person in each hospital. But 10,000 healthcare workers can't cope. The shit that they come out is just beyond belief. It is beyond belief. Like I said, if you take out Victoria, all the other states, 9, 0, 6, 4, 13, 3, and 53 New South Wales. You take out Victoria, where are these 10,000? These 10,000 Australian healthcare workers, half of them are feeling burnt out. ABC, nah, you wouldn't put this bullshit out unless it was real. Royal Melbourne Hospital, nah, you wouldn't put this shit out unless you were really, fair dinkum. 10,000 healthcare workers, and we've got 27 people in hospitals throughout Australia. 300 in Victoria. There's probably 400 in New South Wales. I'd say close to 2,000 hospitals throughout Australia. And we got 27 people, COVID patients. It's just beyond belief. And people will see this and go, oh, we got to feel sorry. Got to feel sorry for these frontline health workers. They're doing it hard. They're doing it hard. How about you go into a cancer ward and see how hard it is? It's beyond belief how this is still going on, and people cannot see what bullshit this is. Will this ever end? I don't think so. I do not think so. The population is in a hypnotic trance, and I don't think they'll ever snap out of it, to be honest.